So all cranial nerves, from an ocular motor standpoint, have a supranuclear, nuclear, and infranuclear components to them. And the infranuclear pathway has both the neuromuscular junction and the muscle component. Supra, it means above. Infra, it means below. And so when we're doing the efferent pathway, we would like to know, is it a supranuclear problem, a nuclear problem, or an infranuclear problem? So for example, for the seventh cranial nerve, which controls your face, there is supranuclear input to your face. And it comes from the contralateral cortex. And so an upper motor neuron, seventh nerve parasis, will involve just the lower face because the contralateral cortex is supplying the upper face. Because we have bilateral innervation to the upper and lower face, a lower motor neuron, the seventh, will cause the entire face to be out on that side. And the reason that's important is, if we just have a lower face, that is actually upper motor neuron, and that is counterintuitive that a lower facial nerve palsy would be upper motor neuron, and that's because of preservation of the forehead. And so if I ask the resident in a patient who has what looks like a seventh on the left, and the left face is weak, if the question is the problem on the right side, the left side, either or neither or both, you cannot tell by just a seventh nerve parasis whether it's right side or left side. We need to know whether it's the lower face, the upper face, or both to be able to answer the question, is it right, left, either, neither, or both. However, in a lower face paralysis with sparing of the upper face, we know that is upper motor neuron, and so in that case, a left cranial nerve 7 palsy, that is upper motor neuron, is actually a problem with the right side. So just like other cranial nerves, 7 has innervation from supranuclear input, and so if we just put in the third nerve here, the third nerve has a nucleus in the midbrain. It's got a peripheral nerve. It's connected to the neuromuscular junction and to the muscle. But there's supranuclear input that controls the third, that tells the third nerve to do voluntary eye movements. However, we can also talk to the nucleus with the vestibular ocular reflex, the doll's head maneuver, that does not require any supranuclear input. And so we can use the doll's head maneuver to determine whether we have a supranuclear palsy, a nuclear or infranuclear palsy, using the vestibular ocular reflex, the doll's head maneuver. So as a structure, if in general you think about supranuclear, nuclear, and infranuclear, then you will help yourself in terms of localization. And the doll's head maneuver is what we're going to be using to differentiate the supranuclear palsies. Once it becomes a third nerve palsy, then you only have to decide, is it nuclear, fascicle, the part in the brainstem, or the peripheral nerve. And the same can be said for fourth and sixth nerve. Supranuclear, nuclear, infranuclear, always have a system. And starting off with, could it be supranuclear? All right.